Yes, thank you. Okay, and good morning and good afternoon, good evening, everyone, wherever you're joining from, and welcome to this webinar. On behalf of the Wastewater Surveillance for Africa initiative, I'm delighted to welcome you to this today's webinar, which is about introduction to the wastewater and environmental surveillance, public health and ecosystem protection. So this will be the first webinar in UNEP and WHO's news webinar series. Maybe I can hear some background noises if we can mute everyone. Let's see. Yes, so the series is aiming to build knowledge and foster collaboration and spotlight innovative practices in wastewater and environmental surveillance across Africa. So thank you all for taking the time to join us. First, I will share some housekeeping rules that we are all in the same page about how the webinar will be going through. So this session will be recorded, and this will be part of our upcoming training program, which I will tell you a bit more a bit later on. And yes, so we please kindly ask you to stay muted and place your cameras off during the presentations, so that we will avoid the background noises from the possible background noises from the participants. You can use the chat for questions anytime during the webinar, and we will address them during the dedicated question and answer sessions after each presentations. And there will also be time for live questions after the presentation. So yes, we will give you the floor if you will raise your hand during those sessions. And then most and last of all, be respectful and inclusive. We welcome all diverse voices and encourage a respectful dialogue throughout this event. So with this, I hope it's all clear for us, the short rules of this event. And next, I will give you just a very short welcoming remarks from UNEP side, and then we will hear also from the EU HERA side some welcoming remarks before we can dive into the interesting presentation of today. So as the part of the United Nations Environment Programme, we are proud to launch this webinar in collaboration with WHO as part of the Wastewater Surveillance for Africa initiative. So in many parts of Africa, communities are facing overlapping challenges, limited access to health infrastructure, growing pressure on ecosystem, and increased vulnerability to disease outbreaks and environmental contamination. So wastewater and environmental surveillance is a powerful, cost-effective, and non-invasive tool that to monitor these threats. And UNEP is deeply committed to advancing the solutions that break silos and then also bridge health and environmental goals, for which this webinar is also part of aiming to do so. With these words, I am very pleased to present you today's expert speakers, and we will have a bit broader introducing before their presentations. But these speakers are here to help set the stage for this webinar series. And first, we will hear from Kerika McCartney from National Institute for Communicable Diseases from South Africa, who will touch bases with the public health side of WES. And then following that, we will hear from Innocent Makelo from National Environmental Management Authority from Uganda, who will present the environmental perspective of WES. With further ado, I would like to give the floor next to Angela from EU HERA, who will give her welcoming remarks. I hope she's online already. Let me check.
Yes, Taru, I'm here.
Great, thank you.
I hope you can hear me well.
Yes, I can hear you well. The screen or stage is yours to share some couple of words if you wish.
Thank you. Yes, thanks a lot for this opportunity. First of all, congratulations on organizing this first webinar. We had many people signing up and many people are in the meeting today. So this is really a fantastic milestone and really speaks to the strong interest that there is in wastewater surveillance. So really let me thank UNEP and of course also WHO, and also welcome to our speakers today. The European Commission through HERA, the Health Emergency Preparedness and Response Authority, is really proud to support the Wastewater Surveillance for Africa initiative, which will be briefly presented later. And this first workshop really marks the start of a very important activity for training and capacity building. At HERA, we see a real value in building capacity for wastewater surveillance, not only in Africa, but really globally. We also recognize, of course, that countries do not have all the same level of implementation of wastewater surveillance. And this is why we really want to invest in capacity building. I think initiatives like these initiatives like Wastewater Surveillance for Africa are extremely important because they can really leverage what's being done in the field and share best practices. So this is great opportunity for shared learning, collaboration, and collective progress. As Taro mentioned, this webinar is not a standalone event. It's really part of a broader series of training sessions that will explore different aspects of wastewater surveillance, but also offer practical hands-on insights. That's something that it's really important and unique about this series of webinar. And also, as was presented by Taru, today's session is about really setting the stage by covering the basics so that basically we can all start from the same understanding, have a common ground, and go towards a final objective together, starting from a similar standing point. One important thing that I would like to highlight is let's not hesitate to ask questions. This is really a good opportunity for all of us to really ask all the questions that we may have. We have great experts with us, and let's try to be as open and engaged and proactive as possible, and to make this session as productive also as possible, but also really to hear and learn from each other. So with that, I would like to congratulate you again, and I hope we will have a fruitful first webinar. Thank you.
Thank you so much, Angela, for your kind words, and very much agreed with all of those. And next, so that we will have a bit of background for the webinar, I would invite Ricardo Zenaro from UNEP to share a bit of introduction or background about the initiative itself. So the screen is yours, Ricardo.
Yeah, thank you so much, Taro, and good afternoon, everyone. It's a true pleasure seeing so many of you connected and joining from many corners of the continent and beyond. I have a few slides for you, but before going to the presentation, just want to say that I'm part of the UNEP team steering this initiative. We have interacted with some of you who are online already, and we're very, very pleased also to have new participants on board. So my job today is quite simple. I want to share with you some of the details of this initiative. Allow me to bring a short PowerPoint to the screen. Okay. Please bear with me for a few more seconds while the PowerPoint loads, and then we're good to go. Great. So indeed, this is an initiative, I would say, a very ambitious and innovative, I would say, initiative, because it brings together the environmental and the public health perspective in a project that wants to support strategies, capacity, and also data generation and sharing for global wastewater and environmental surveillance. You can see the title there on the screen, while focusing on the African continent. And it's an initiative that started last year in July 2024. We have actually 30 months to work with many of you and to actually support you, governments, and also the relevant stakeholders in establishing and scaling up wastewater surveillance systems for basically what I was mentioning earlier, for purposes of public health and ecosystem health. Some of the specific objectives also, as you can see on the screen, speak to enhancing capacity, building strategies, and very much, I would say, leverage on what your countries and what the knowledge is at the moment. We have seen, I think, a very interesting and steep increasing interest in wastewater surveillance globally. And Africa, of course, is very much on the radar, and with many, many best practices that can be shared among stakeholders. So we are very, very happy that we could help, actually, as like Angela was saying, we can help this change. We can help actually in stepping up in terms of bringing wastewater even higher on political agenda, but also I always like to say practical agenda in terms of using it for purposes of public health and environmental protection. A brief background of our role, UNEP's role, actually, in this regard. I want to share with you our mandate. So our mandate in terms of focusing on wastewater surveillance comes from the famous One Health approach, which literally recognizes this link between environmental, human, and also animal health. You might be well aware that UNEP is one of the agencies that are part of the Quadripartite Alliance, comprising also of, for instance, the Food and Agriculture Organization of the United Nations and WHO, the World Health Organization, which constitute indeed this alliance, and abide by the joint plan of action. You can see this is coming from documents that have been agreed upon by organizations on the global level, and that speaks exactly about the use of surveillance for sound management of chemicals and waste, and also for public health. And then more on the UNEP side, I think we have one very important resolution, and stems from the United Nations Environment Assembly, a recent assembly, whereby we had a resolution focusing on biodiversity and health, which is exactly about implementing the One Health approach. So this initiative very much stems from that mandate and also aims to contribute to implementing such resolution. I won't focus in details about the activities. All you need to know is that there are four very, I would say, clear outputs under this initiative. The first one, first and foremost, is to understand what's the capacity level across Africa when it comes to wastewater surveillance. So we are working to actually have capacity needs assessment done to analyze such situation. It's a very ambitious target, of course. And to do that, we also want to make use of, for instance, events, regional events that help us not only to train stakeholders and to, I would say, sort of get this change in motion, but also to understand what's the level of capacity. This will then allow us to do what? To actually suggest a harmonized approach for the continent when it comes to wastewater surveillance for purposes of public health and ecosystem protection, ecosystem health. The second, I would say, objective or output very much focuses on the countries. So through this initiative, we also want to provide countries with a roadmap document that helps countries, as I said earlier, either to establish or to enhance the use of wastewater surveillance. And of course, we have already started working with a wide range of stakeholders across the continent to do so. Output 3, though, is, I would say, on another note, very much focusing on communication. We all know that communication is essential for everything. And in this initiative as well, we will produce, and we are already producing, a number of tools and outreach material that can help us disseminate data, disseminate information, And of course, this webinar, this initial webinar of the series is part of this effort. Finally, last but not least, we have one very important output which involves working with airports and ports in Africa. And we want to, in this regard, really help this effort made at the global level in terms of working with airports, with transportation hubs, which are a very important source of information when it comes to pandemic preparedness, when it comes to public health, and also environmental protection. So we're very, very excited that some of the collaborations are already ongoing, and hopefully many of you will be able also to be involved and also to actually approach us with interest to be involved. The main stakeholders, I would just say all of you. All of you are extremely important stakeholders, starting, of course, with the government, but also with international organizations, research institutes that drive this change at country level, non-profit organizations, private sector, and so on and so forth. I will, I think, go to our update. I want to just give you the flavor of some of the milestones of the past few months. So here on the screen, you see a happy picture of one of the regional workshops that were hosted earlier this year. This one specifically is from South Africa, where the Southern African countries, so we had 15 countries actually, to be specific, represented there, came together and actually got some very good knowledge, training, and also had a wonderful exchange in terms of how are they actually using wastewater surveillance? How is it useful? Can we do things better? Can we actually cooperate between the Ministry of Environment and the Ministry of Health? And I think it was a wonderful first regional workshop, but also you can really tell that there is so much more potential when coming together, especially across, I would say, disciplines and ministries. And a similar workshop was actually held here in Nairobi just about 2 months ago, when 11 countries from the Eastern Africa region came together. Looking ahead, very briefly, we will work with the Northern Africa, Western and Central Africa regions to do pretty much the same exercise we did in Southern Africa and Eastern Africa. So I hope that many of you listening in from those regions will be involved. And we will also continue this webinar series. This is the first one of 8 webinar series that will provide you with very, very good information, but also opportunities to connect regarding these topics. And as I mentioned earlier, our work at the 3 airports that are mentioned on the screen, Kigali, Johannesburg, and Nairobi, is getting ready. And we hope that this will be also helping the continents to advance wastewater surveillance on a larger scale. I will stop there for the sake of time, Taro. I just want to say thank you, everyone, for being here and welcome again. And we look forward, as I said, to working with many of you. Over to you and back to our speakers. Thank you, Taro.
Thank you so much, Ricardo. That was a very, very good presentation about the already happened activities and also a look for the further activities. And as this is the first webinar of this series, I will next very, very shortly introduce you the aim of the webinar series, as so that you are aware what is why we are here today and what is upcoming next after this webinar. So as said earlier, this series is part of a broader effort to build awareness, capacity, and collaboration around the role of wastewater and environmental surveillance in protecting both public health and environment. And particularly, we are focusing here in the African context. So we aim to raise awareness, strengthen the capacity, share real-world experiences of WES, and foster dialogue between different sectors. So we have planned in total 8 webinars to serve as a thematic sessions over the coming months, and each webinar will spotlight both public health and environmental perspectives and combining both technical insights with case studies from the field. And in parallel to the webinars, we are also developing an online training program that will be launched later this year. And after each webinar, also today, in the end of this webinar, you will receive a link to a survey and a QR code. Through this survey, you will have a possibility to affect the upcoming webinar topics and also indicate whether these webinar topics should be included in the upcoming training program. So this survey, we really wish you all to answer it. We have tried to keep it very short, so it won't take a lot of time, but it is a great possibility for all of you to really also affect the upcoming webinars and also the training program. And after completing the training program, we will be providing certificate for the participants upon the successful completion. So there is also that point of view in this whole training program. That's just a very short introduction to this webinar series. And now I think I will give the floor to Monica Nolan, who will be from WHO, who will be moderating the next session, which will be focusing on the public health side of wastewater and environmental surveillance. So screen and stage is yours, Monica, if you're still there. See. Maybe Monica, if you're not, are you there? No, I don't. I see you there, but let's see. Okay, but maybe I can then also, of course, introduce our next speaker, and then hopefully Monica will be back online for the question and answer section that we will have after each presentation. So there will be time for you all to share questions, and then we will have answers from our expert speakers. So the next speaker will be Kerika McCarthy, who is a medical doctor trained in clinical microbiology, and she has over 20 years of experience working in communicable diseases public health programs. And presently, she works in the Center for Vaccines and Immunology at the National Institute for Communicable Diseases, South Africa, where she works with polio, measles, and wastewater surveillance teams. So I think maybe, Kerika, you can then share your slides and presentation, and I will give the floor to you. Thank you very much.
Morning or good afternoon, everybody. Are you able?
Yes, we can hear you well and see the presentation.
Super. So firstly, thank you to the organizers, to UNEP and colleagues for the opportunity to join this webinar and to share with you our South African experience. It is a wonderful platform, obviously today now for our program, but going forward for the continent to develop an interest and following and create capacity for this very important emerging surveillance modality. So the talk today that I'll be sharing with you is entitled Disease Surveillance Using Wastewater, a complementary data source to support public health decision making. And I will be going forward with the following topics in this talk. Firstly, I'll give you a short history of disease surveillance using wastewater. Secondly, we will be applying some empiric thinking, asking what do we need to know to have confidence that disease surveillance using wastewater is useful. And then lastly, I'll share with you 2 case studies about illustrating how our wastewater data made a difference in South Africa this year in 2025. So wastewater surveillance is not something new at all. If we look back in the literature, we can see a number of examples as early as the 1940s. This article looked at the detection of typhoid in towns by means of looking at sewage. And later on, someone called Moore identified or developed a swab, which he placed in sewers, and he was able to identify Vibrio cholera from sewage. But things didn't stop there, and researchers who were interested in polio were particularly keen to apply wastewater surveillance during polio outbreaks, and noticed that poliovirus was detected in outbreaks of polio and also in subsequent vaccination campaigns. And history went on, and environmental surveillance became an important part of the polio containing surveillance program to support polio elimination. People applied various tools, mathematical models, and eventually the WHO sat up and paid attention and produced a very important document called Guidelines for Environmental Surveillance for Polio Circulation. And many countries from the early 2000s started implementing wastewater surveillance for polio. Until 2015, the WHO developed an environmental surveillance expansion plan for polio. And these days, the kind of articles that you see in the literature around polio environmental surveillance are in fact evaluating the contribution of polio environmental surveillance to the global elimination project. But fast forward to COVID-19. In 2020, a few countries simultaneously across the world, the Netherlands, Australia, demonstrated the presence of SARS-CoV-2 in wastewater. And in South Africa, our own country here on the continent, the South African Medical Research Council had a proof of concept paper published in our own local South African medical journal reporting on the qualitative and quantitative detection of SARS-CoV-2. And since then, we still to this day don't stop reading about all sorts of multiple use cases of wastewater surveillance for SARS-CoV-2. Papers such as the first detection or early warning applications, disease control, monitoring trends, and even from our own group, looking at the distribution and correlation of cases with wastewater levels and also genomic findings directly from sequencing the virus in wastewater. So the question that was left with us after COVID was, what about using wastewater surveillance for other pathogens? And so as we started thinking, we realized that we needed to use an empirical approach to build evidence to answer these questions. Can other pathogens be detected in wastewater? Which laboratory methods enhance detection of these pathogens in wastewater? What is the relationship between wastewater detection and laboratory-based clinical surveillance? And further than that, what is the relationship between wastewater detection and disease epidemiology? Can wastewater surveillance be used for reproductive number determination? What is the minimum data set required to accurately estimate patterns of disease? And really the nub of the question is, what is the value of wastewater surveillance in relation to other surveillance data? So addressing each of these questions in turn, at the NICD, we chose to investigate the role of wastewater surveillance for vaccine-preventable disease. We developed and optimized PCR assays based on clinical diagnostic assays using the same primers and targets, and we tested these assays on retained wastewater concentrates that we'd kept from our SARS-CoV-2 surveillance. And later, in response to emerging public health threats, we added mpox. And because we live in a country that has the highest incidence, or one of the highest incidences of tuberculosis globally, we're also adding Mycobacterium tuberculosis to our targets. And of course, globally, wastewater surveillance is being explored for a whole range of pathogens, enteric pathogens, including typhoid, cholera, and parasites such as dengue. The approach we took was, as you see in the middle, to develop digital PCR methods and to establish the assay limit of detection through spiking experiments and experiments conducted using quantitative PCR platforms in parallel with digital PCR in order to determine the sensitivity, specificity, and the optimal PCR cycle conditions to support amplification of our target regions. We then applied our newfound methods to retained concentrates from national surveillance, from sentinel site surveillance, samples collected for SARS-CoV-2 wastewater surveillance. And much to our joy and surprise, we detected measles, rubella, hepatitis A, hepatitis E, and influenza from these retained concentrates, albeit sometimes in low proportions. So we went on then to focus on what are the ways that we can optimize sample processing, wastewater sample processing, to give the best yield of nucleic acid and to minimize inhibitors. We experimented with digital PCR versus quantitative PCR and established the analytical precision and accuracy, and also compared the costs of the two methods. We looked at ultrafiltration versus bead-based processing, and not shown here also PEG processing, which is well known to persons in the polio program. We conducted assays in parallel after clear delineation of laboratory workflows. And in our hands, we found that bead-based extraction method is higher for certain pathogens, and for rubella, for example, ultrafiltration is still best. We also looked at the part of the wastewater matrix that is more likely to yield higher concentrations of particular pathogens, and we conducted spiking experiments with wastewater from the field with positive controls to determine the partitioning characteristics of each virus. And we established that each virus has different behaviors. So, for example, SARS-CoV-2 is best found in the supernatant, whilst Mpox and TB are found in the suspended sediment that can be centrifuged and drawn to the bottom of a laboratory tube. We've also subsequently looked at and continue to investigate sample storage protocols that help us to retain samples whilst optimizing the stability and integrity of RNA. And so we've looked at storing and retaining different compartments of wastewater, ranging from raw sewage, sludge, nucleic acid extract, and are conducting longitudinal assessment on these. To address the question of the relationship between wastewater detection and laboratory surveillance, we established during COVID that, like many other countries in the world, the SARS-CoV-2 wastewater data was highly correlated with clinical case counts during the early part of the SARS-CoV-2 pandemic, when clinical testing was pervasively rolled out through a combination of public concern, increased test availability, and legislated programs such as occupational requirements for returning to work. And it was very helpful to have this demonstration of the correlation between the two, because it told us that wastewater is a good sample to capture SARS-CoV-2 and to give some inference around the burden of disease in populations. But moving on, not only to the relationship between detection and clinical surveillance testing, what about the relationship between detection and disease epidemiology? South Africa and the NICD is fortunate to have a well-established severe respiratory illness surveillance program that is used for both influenza, RSV, and SARS-CoV-2 syndromic surveillance. We have a number of sites across the country where people who are admitted with severe respiratory infection, pneumonia, are enrolled, and then their samples are tested routinely for influenza, SARS-CoV-2, and RSV. And we were able to compare our wastewater findings with these clinical findings. And you can see in the figure below, for the same year and epidemiological weeks where clinical surveillance was done, that wastewater surveillance demonstrated the presence of influenza A, and may even have given a heads up or an early warning signal about the start of the influenza season. South Africa is characterized by winter, in other words, March to July influenza seasons, And our wastewater surveillance, looking at the number of samples that tested positive and the proportion testing positive, was firstly well aligned with the clinical surveillance, and perhaps even able to give a good advanced signal. And this, of course, is useful for countries where clinical surveillance is not perhaps fully representative of populations, or is not rolled out at all, because clinical surveillance, of course, is difficult to implement. So this is an example of one application of wastewater surveillance where we have provided some evidence in our context that the signals in wastewater correspond to the signals in clinical surveillance. What about the use of wastewater surveillance for modeling important transmission dynamics, such as the effective reproductive number? The effective reproductive number, of course, tells us how rapidly an infection spreads and is useful during outbreak or pandemic or epidemic monitoring, because it gives us a sense of whether the interventions, such as vaccination campaigns, are having an effect in terms of the decrease or the anticipated decrease in the cases, and can also give us give us good warning as to the trajectory of an outbreak, if it's going up or not. And in work done by Zinhle Makatini and Kathleen O'Reilly from the London School, in a manuscript that is in preparation, we were able to show, using data from our South African SARS-CoV-2 surveillance, that wastewater surveillance is able to generate the effective reproductive number in just as well as clinical data. And then what about the value of wastewater surveillance data in relation to other data sources? Using the geolocated SARS-CoV-2 cases that we identified during the large waves of SARS-CoV-2 infection, and together with wastewater surveillance data from 2 very localized sewer sheds in Gauteng province in South Africa, we were able to look and compare the SARS-CoV-2 wastewater levels and the clinical infections, whilst at the same time looking at socioeconomic status, population structure, and social attributes. And we showed quite beautifully in 2 sewer sheds the difference between the clinical cases and the economic relationship between the two. So in sewer shed D, you can see in this figure by epidemiological week in 2021 and 2022, the number of cases in green bars, or the incidence of disease, and the number of genome copies per mil of SARS-CoV-2 on the right axis in the brown line. And this sewer shed D was, in comparison to sewer shed O, rich. They were also economically, in other words, economically advantaged, and the case burden and disease incidence was high. But if we look at the sewer shed O, you can see at a glance that the wastewater levels followed the same pattern and were more or less the same height, but the epidemiological case wastewater levels, the disease incidence was low, but the wastewater levels were equivalent, suggesting that the disease was circulating in a population 5 times as large at the same rate, although the detected disease rates were low. And so we were able to conclude that wastewater surveillance overcomes the bias in disease detection that happens through routine testing when access to testing is limited. And this is an important point, because we know very well that a disease can only be documented and recorded when a test is available. And that implies that individuals go to look for healthcare, and that clinicians will test, and that clinicians have tests available, and that the results are recorded into some kind of surveillance system. And because wastewater surveillance is able to overcome these limitations, it can provide very important epidemiological insights into disease circulating in underserved communities. Another important area where we have shown value of wastewater surveillance data is in the application of measles surveillance. So we conduct measles surveillance in South Africa through both clinical means and wastewater, and clinicians send blood samples for IgM testing for measles when they encounter a patient with fever and rash. And we were able to look at the clinical data and the wastewater data by epidemiological week for specific districts. And what you'll notice in this table on the right, where we have the wastewater results in columns and the clinical results in rows, that there were districts where wastewater results were positive, but clinical results were negative or not done. In other words, wastewater was detecting transmission of measles when clinical surveillance failed to detect these cases. And we could even expand this to looking at the wastewater results for the week before and the week after clinical results. And we still found the same result, that wastewater surveillance was able to detect the presence of measles in communities when clinical surveillance failed. Where districts where wastewater surveillance are positive but clinical surveillance is negative, this is an important public health sign that clinicians and public health authorities need to be aware of and can use in making decisions around how to prevent measles and eliminate measles by 2030, according to the WHO agendas. So evidence is mounting to support the data to policy pipeline for the implementation of disease surveillance using wastewater as a complementary and essential data source on which to base public health decisions. Starting from the left, we have and are busy and continue together with the global community to answer the primary research questions around detection of pathogens in wastewater. We are looking together with global colleagues the modeling and cost effectiveness questions that happen around wastewater surveillance. And slowly but surely, evidence is mounting that can be collated in systematic reviews and used to form guidelines and conduct health technology assessments. And we're anticipating that it won't be long before wastewater surveillance is implemented alongside clinical surveillance across a range of pathogens as standard of care for public health institutions in each country. So now I'll move on to two brief case studies from our South African context. The first is Mpox, which has been ravaging our continent. South Africa is no exception. And in 2025, this year, we've had 9 clinical cases to date, and all have been reported in or associated with Gauteng province. And we have detected since the beginning of the year a number of wastewater positive signals across the country. What's interesting, and you'll notice in this figure on the right, where the top graph represents wastewater samples that have tested positive for Mpox, and the bottom graph represents laboratory confirmed Mpox cases, both by epidemiological week, that we had a period in the beginning of the year when we had positive wastewater signals from the same areas where clinical cases were identified. This was a learning phase for us. These were the first wastewater positive signals for Mpox, and we noted that, and we were unsure how to report these to public health authorities. But then, when we realized, in fact, that our wastewater surveillance was being paralleled by clinical detection of cases, and we continued in the second quarter of this year to find evidence of evidence of wastewater surveillance, but no clinical cases, we chose to alert our authorities to inform them that, in fact, wastewater was reporting signals of Mpox. And we noted that in week 25 of June, that there were, in fact, 2 other cases of clinical Mpox denoted. And so the impact of this was that there were renewed efforts to distribute Mpox vaccines. Our country has received a mere 4,500 Mpox vaccines, and also importantly to conduct health promotion activities and to train physicians around signs and symptoms and notification of cases. The second case study is the application of measles testing in wastewater across Gauteng province, where we have demonstrated that transmission is actively ongoing across all health districts. In the graph on the left, you can see this shows the number of measles positive cases by district of Gauteng province. And you can see that in the beginning part of the year, there were few cases, but in the recent weeks, the number of cases has increased. If you look at the wastewater detections that we've had during the same epidemiological period, you'll see that we have had ongoing detections of positive wastewater samples across our country in the beginning part of the year, with a quiescence and again a resurgence in parallel with the resurgence of clinical cases. The bottom line is that wastewater surveillance is showing that the distribution of cases in the province is far wider than that detected by clinical surveillance, and an active supplementary immunization response activity is underway in order to contain the transmission of measles. So that brings me to the conclusion that based on the simple evidence that we have gathered to date in South Africa and other countries across the world, I think that disease surveillance using wastewater is here to stay. And I would encourage all of us across the continent to start our wastewater journey to support public health decision making as soon as we can. In closing, I'd like to acknowledge the team at the NICD, my co-lead, Muklid Yusuf, with the Wastewater Genomics Syndicate, most importantly, our funders, the Gates Foundation, and then various folks across the country and the world who have supported us on various aspects of this work. Thank you.
Thank you, Dr. Kerrigan-McCarthy. That's been a tour de force. I do hope that my audio is now working. Can you hear me?
Yes, we can hear
fantastic.
you loud and clear.
I think in many ways, Kerrigan-McCarthy doesn't need any introduction to so many of us working in this space. Your generosity and leadership has been just exemplary, and it's again no surprise that the presentation today touched on so many important areas. So my name is Dr. Monica Nolan. I'm a senior technical advisor in the wastewater surveillance space, working with WHO headquarters. And it's been a delight to work in partnership with UNEP in delivering many of these activities, including the launch of the webinar series. So it's just my role now to open it up for questions and discussion. I know that there's a couple of questions that have already been posted in the chat, but I also invite members just to, if you'd like to intervene verbally, just put up your hand and I'll call on you. I think I noticed Martin Fee from Senegal asked a question around Kerrigan, what were the specific public health actions, if any, following your influenza A detections, or was that also sort of a learning around the correlation phase? I think it's been very nice to hear your journey in terms of learning and building the evidence, and then looking at how that can be used effectively for public health action in so many different pathogens. So back to you.
Thanks, Monica. And thanks, Martin, for the question. In fact, because we have such a robust clinical surveillance program, there was no need for any signals to be distributed solely on the basis of wastewater surveillance. And in fact, we had just changed our processing method to a bead-based method, and our sensitivity of detection was vastly improved. So, as you say, Monica, it was a learning phase for us. This season, we've seen similar trends in increases in wastewater. So going forward, we have a team with the South African Centre for Epidemiological Modelling and Analysis looking at the relationship between wastewater and clinical influenza detection, and they will quantify the guidance that we can glean from our experience in using influenza to better understand how to use influenza detection as a tool and what kind of health promotion and health messaging we can deliver on the basis of wastewater surveillance. Thank you.
Terrific, thank you. Another question that had come up, and I know you've got lots of insights in this space, is how would you counsel colleagues to really motivate and provide evidence to decision makers so that they can build trust on wastewater surveillance? It's been a journey for you. Any thoughts there?
I think wastewater surveillance offers another angle on disease transmission through populations that is helpful to either confirm or expand on the epidemiological insights we get through clinical surveillance. It may do this in several layers or levels. It may do this through adding insight into the asymptomatic fraction of the population. It may do this by adding first detections where clinical surveillance is weaker. I think the answer to the question is that it is a highly contextual contribution that wastewater could make. It depends on the extent of health-seeking behavior and clinical diagnostic testing, as well as the surveillance infrastructure in a country, community, population, as to how useful wastewater surveillance will be. So in areas where clinical surveillance is less robust, wastewater surveillance has immense potential to give policymakers insight into what's happening in the community.
Very much, Kerrigan, and we're going to just take one last question, but there's a few more questions in the chat, and I'd really encourage people to put more questions in the chat, and I'm sure, Kerrigan, you could monitor them and respond as well. The one question coming up from Soro Ibrahima Bware is thinking about the many contexts where collective convergent sanitation systems don't exist, and what do you think about the applicability and effectiveness of wastewater and environmental surveillance in those kind of settings?
Thank you for that question. I think it's important. Wastewater sample processing methods need to be slightly altered for less concentrated specimens, such as seen in rivers or open sewers. And nonetheless, the potential for detection of pathogens in these samples exists. We have some experience in looking at SARS-CoV-2 in environmental water sources, that's rivers in and around Gauteng, in areas of informality, so that is in informal settlements or in areas with very poor sanitation or damaged sanitation infrastructure. And we were able to glean the same signals from the environmental surveillance wastewater sources that we were able to generate from highly concentrated wastewater sewage treatment plants. So there's good evidence that wastewater surveillance is applicable in a variety of contexts.
Terrific. Thank you so much, Dr. McCarthy, for your presentation and response to the various questions. It's really encouraging, particularly to see the case studies that you presented as we march forward to measles and elimination, although there's a few setbacks on the journey there, as well as particularly for Mpox. That's really exciting to see. And with that, I'd like to hand back to Tara. Thank you.
Thank you very much, both Kerrigan and Monica, for moderating. And as Monica said, we encourage you all to place any further questions to the chat or Q&A box. So perhaps Kerrigan can then pick up from there and respond to the ones that are aimed to her about her presentation. But next, I will give floor to Poppy Karaolia, who will introduce our next speaker. So the screen is yours, Poppy.
Thank you so much, Taru. So hi, everybody. My name is Poppy Karaoya. I'm a senior expert consultant for wastewater surveillance in Africa. And today I have the pleasure of introducing Michaelo Innocent, who is the next speaker of our webinar, and he will be providing an overview of environmental surveillance aspects regarding wastewater. So Michaelo Innocent is an environmental inspector in monitoring, inspections and audits division of the National Environment Management Authority, or NEMA, in Uganda. And he has studied chemical engineering and climate change and health, and is a member of the National Coordinating Committee of the Stockholm Convention. In addition to contributing to regional and national projects regarding green mobility and environmental surveillance for wastewater, he has experience with environmental compliance and air quality management. So I would like to give the floor to Michaelo, and we look forward to a very interesting presentation. Thank you.
Thank you, Poppy, for that introduction. I don't know if I'm audible enough.
Yes, we can hear you very well.
Thank you.
And
Hi, everyone.
Sorry, I will share your screen. If you just say it next, then I will always change the slide. Thank you.
All right. All right. Good morning, good afternoon, and good evening from wherever you are. And once again, I welcome you to this webinar. I'll be taking you through wastewater and environmental surveillance in Uganda, and I'll be giving an environmental perspective. So next. Yeah, about wastewater and environmental surveillance in Uganda. Here we do monitor pollutants and health indicators in wastewater, focus on ecosystem and public health protection. And when we are doing that, we provide compliance to the facilities or different stakeholders. Then it helps us in policy making, and also it works as a system for early warning. Next. Now, wastewater monitoring, the environmental perspective in Uganda, I would say, is done mostly by Ministry of Water and Environment. That is mandated to realize Article 39 of the Constitution of Uganda, that states that every Ugandan has a right to a clean and healthy environment. And under the Ministry of Water and Environment, there are different agencies like the National Water and Storage Corporation, National Environment Management Authority, and there's a Directorate of Water Resources Management. Now, all these three divisions have different roles that they play. For example, National Water and Storage Corporation deals more with wastewater treatment for the public, and also sewage treatment. Then NEMA is mandated to supervise and coordinate all aspects of the environment. Then Directorate of Wastewater Resources Management is there to actually safeguard the water resources we have in the country. That's to take into like the rivers, the lakes, and everything around. Thank you. Next. Now, why does it matter for us to monitor wastewater in Uganda for the environment? Well, wastewater has a lot of impacts, both on the ecosystem and the human health. Now, that is need for us to, that raises the need for us to monitor the wastewater. And in so doing, we help to improve the ecosystems and also the lives of the people. Then there's a frequent discharge of untreated wastewater in Uganda. Now, I'll give you a brief history where I'll tell you that until 2008, there was no wastewater treatment plant for the industries in Uganda. Remember, NEMA was instituted in Uganda around 1995, and from 1995 up to 2008, people were just discharging wastewater untreated, I mean, from the industrial facilities. So there was need for us to, to come up and revise the discharge standards. We could put it in we have what we call the environmental social impact assessments that we give out to these facilities when they're starting up. But again, in the conditions when we put, you're meant to treat your wastewater before you discharge it into the environment, we were not enforcing it that much. That's why I think the current ED, the executive director, when he came into power, we had to move on from other aspects. For example, protecting wetlands, forests, and we had to enforce even this because it was deteriorating the quality of the ecosystems. Next, we are doing this because there is rapid urbanization and industrial growth. Kampala particularly, Kampala is housing a lot of people. There's a lot of population. There's a high population around Kampala, and Kampala is on the shores of Lake Victoria, you know. So a lot of people are around Kampala because even the industrial parks are around Kampala. We have like 2 or 3 industrial parks around Kampala. So that makes it like this rapid urbanization are just around the city only. So there is need for us to do what? Environmental surveillance. Then also it supports compliance, policy making, and early warning systems, you know, in case there is a deterioration of, for example, the shores of Lake Victoria, like you shall be seeing in one of my case studies. You can actually tell if you've been doing monitoring. You can actually tell that, yeah, indeed, we're on the verge of like a negative downslide, something like that, you know. And also there's need because this wastewater also is affecting the climate in a way, you know. Yeah, thank you. Next. Now this is just pictorial of one of our field visits. On the top left, you can see that is a wastewater treatment plant for one of the companies we have in Uganda, and it's just close to the River Nile in the background. You can even see the bridge. So if you do not do monitoring of these facilities, there is actually deterioration. We are losing a lot of species in the water. You know, fish is dying. Different things are dying in the water bodies. So there's need. Then there's also, we need to protect the public. As you can see, the next picture, as you go to the right, you're seeing the team sampling from a manhole. Now, some of these facilities have had these manholes or like sewage tunnels constructed from way back in the 19s. They were not treating water. They would discharge. So someone would construct a sewage tunnel that transports untreated wastewater for a distance of even close to 1 kilometer straight into the lake or the river. So we had to come strong and enforce some of these things. Yeah, this is just a pictorial showing you how we do these things. Next. Now, what do we monitor as NEMA? Maybe the Minister of Health will tell you they monitor things to do with pathogens and what, but here we monitor chemical parameters mostly. And with industries, we do monitor heavy metals. We have industries that are manufacturing batteries, maybe plastics, whatsoever, and most of these places have heavy metals in them. So we do monitor industrial heavy metals like lead, chromium, zinc, manganese, you know, cadmium, a lot of those. Then we have agricultural facilities that use fertilizers, pesticides, and some of these things even have also chemicals, many chemicals in them. Actually, I would say we have golf courses along the shores of the lakes. You know, a golf course would want their grass to grow in a way, so they apply fertilizers. Maybe they even do spray them with these insecticides or pesticides. So they have a lot of them, and those agricultural facilities, their fertilizers have things like nitrates. They have phosphates. You know, a lot of them. Then for urban, that is more like National Water and Sewage Corporation that is monitoring urban sewage. That is biological oxygen demand, chemical oxygen demand, fecal coliforms, all those ones in the from the urban wastewater. And to do with urban wastewater, we do not have a fully constructed sewage system like the way you would see in Nairobi. No, we do not. Here we do voluntary emptying of our septic tanks and everything. So we do not have that sewage system that is connected straight to one treatment plant. Like, you know, we do not have it developed yet that much, I would say. Then we have a lot of pharmaceutical industries coming up in Uganda. You know, we do have to monitor them because they're also releasing these pharmaceutical chemicals into the lakes and the rivers. Next. Now, what are our objectives as we are doing this? One of them is to identify pollution hotspots and trends, like we shall be seeing in my case study. When you know there is industries that use a lot of water, you know, for example, I would say all facilities that use a lot of, I would say an example like a flower farm. Flower farms do use a lot of water. They abstract a lot of water. And that means they use this water and again discharge it. Some of it, there's a runoff that comes from their facilities. So when you know that you have like 5 of these situated along the shores, that is a pollution hotspot, you know. If you had like 7 cement manufacturing industries along the shores of the lake, that is less pressure for you to monitor the wastewater, because cement factories do not use that much of the water. If you had sugar processing, that means you're going to monitor, because that is a pollution hotspot. Then also one of the objectives is inform catchment and ecosystem management. You need to know how you're doing. Because ecosystems do benefit us. Like I always tell people, the environment can survive without humans, but humans cannot survive without the environment, you know. So we have to support enforcement and remediation actions. So we usually have what we call like remediation actions, you know. Someone found polluting, you have to work hard and actually counter whatever you put there, in a way that if you've been discharging and you've polluted the area over time and you stop eventually, you know, then with you discharging now clean water over time, the area will get better. Then you have to monitor compliance with national discharge standards. And NEMA had its first discharge standards developed in I think 1995, and they were revised again in 2020. These revisions need to come in because a lot of chemicals come on market each and every other day. The new pollutants come on market each and every other day. The country is importing a lot of products, you know, raw materials and products. So with this kind of emerging industries, you can never know what has come in, you know. So that's why you need to do monitor compliance with this discharge, and you need to actually revise them according to what has transpired in the recent years. Next. So my case study, I'll be talking about algal bloom on Lake Victoria. Algae is that green chlorophyll-like plant you're seeing on that picture down there. And we've been having this happening on Lake Victoria. And to me, I would look at it like an early warning sign for us that actually this is the only chance you get to see pollution. I would term it like that. You've had chance to see pollution, because when you see algae, that means there are some nutrients it's feeding on, you know. So an algal bloom is the rapid increase of the algae population in an aquatic ecosystem. Basically, algae thrives where there is abundance of nutrients. These 2 main nutrients are phosphorus and nitrogen, usually. So if you have like, for example, a hotel close to a lake shore and it's not treating its wastewater, that means all the water that is coming from bathrooms, that maybe washrooms, whatever, it has a lot of nitrogen and has a lot of phosphorus. When it goes straight into the lake, that's the time when you will see the algae come up. And that is an early warning sign that actually there is pollution going on and you're killing the ecosystem within the water. Next. So nitrogen and phosphorus, like I've said, they affect the growth of algae. So what has been causing some of these things to like to sprout up in the lake? So we have a channel called Nachivo channel that carries a lot of water around the entire city, from industrial areas like Bugorovi and other areas. So this channel spans just around the entire city. It carries a lot of things, you know, and deposits it all in the lake, you know. Then the sewage from entities, buildings, and malls that are not connected to the sewer line. We have one sewer line that is not even fully functional. We've not developed it to the extent that it should be managing all our waste. Then we have runoff from land containing nutrients, then industrial effluents from various industries that discharge into Maction Bay catchment area. We have what we call the Makshan Bay catchment area that is close to Entebbe International Airport there. And most of these industries, when they discharge, like I said, they're along the shores of the lake. They discharge, so you would see actually algae come up in those areas. Then, like I said, the fertilizers from different flower farms, maybe golf course, whatever. Those agricultural facilities that are using fertilizers are also polluting. Then dispose of solid waste directly into the lake and natural channel around Makshan Bay. Next. So what has NEMA done about this whole thing, about the algae bloom? So we conduct inspections and monitoring of facilities and industries to ensure that their effluents meet the standards before discharge, like I was mentioning earlier on. Then we regulate through issuance of what we call the environmental and social impact assessments. And currently, you can see NEMA is not issuing any impact assessments to people that want to develop wetlands or near any areas of ecological importance. So we are no longer issuing permits for you to use the wetland or these shores of the lake. And we issue environmental impact assessment certificates to guide construction and operation activities that are likely to have an impact on the environment. That environmental and social impact assessment is a certificate, and behind it, it comes with a lot of conditions on it. One of them is most of them are like protect the environment, then also to protect the social aspect, which are the workers. So we also restoration of lacustrine in wetland areas in order to protect the lake. We have served environmental restoration orders to all settlers in wetlands to vacate, and this part of the ongoing 10-year strategic plan for wetland restoration. Now, we have people that had started encroaching on the wetlands, and wetlands help us sieve the water, actually. Wetlands sieve a lot of water from within the city or wherever, whichever water comes into the wetlands. They are good for like cleaning the water. A case in point, there was even a study that was conducted by a researcher on yams that were planted in a wetland, only to find out that that those yams are actually having heavy metals in them, you know? So that shows you how much wetlands are quite effective. Now, NEMA has a 10-year strategic plan whereby they're evicting people from these wetland areas. You know, it's because if you over encroach on them, we shall even lose the little margin we have to sieve the water before it meets the larger water bodies. Then we are also not approving any developments in radius of 100 meters of lake interface. That is also one of the aspects we are monitoring or we are doing. Next. Now, our GIS team developed these images over time. You can see top left is 2016, 2020, and then 2025 below. Now, these satellite images show you how much algae bloom has been coming up. You know, you can see that 2016, the margin was not that big. But as you move to 2020 and 2025, you can see that we are actually polluting all these industries, all facilities, wherever they're actually polluting, and there is need for surveillance for us to be able to restore. So like I said, whenever you see that there is algae coming up, there is a nutrient, either phosphorus or nitrate, that they are feeding on, and this does not come on its own. It is coming because someone is discharging into the lake. Now, unlike us humans who are able to go and buy a bottle of clean water, the fish or the organisms in the lake cannot buy clean water. So we are actually suffocating them. And even us that abstract the clean water for domestic and maybe industrial purposes, we are losing out. Thank you. Next. Yeah, this is now the entire lake. You can see these are satellite images also. They show you how clean the water was by the way when you look at it, like it's dark, that means there's less pollution. But as more it gets to lighter and lighter colors, the gray you're seeing, that means we are making it poorer and poorer. Next. So to me, I feel like wastewater surveillance is vital for ecosystem and population health in Uganda, and we need to strengthen our lab and field infrastructure, because we may not be even monitoring all the pollutants at this moment, because maybe some of them we do not have the capacity to do what, to monitor them. So we need to strengthen and even improve on our infrastructure. Then we need to expand to wetlands. Like I was saying, we need to evict more people away from these wetlands so that we are able to have our urban drains. Then we have to foster regional data sharing and learning, something like we are doing right now. We can learn from one another. What maybe our neighbors are doing, we can copy. Next. Yeah, and I think that is it. Thank you.
So thank you so much. Very interesting presentation regarding the wastewater and environmental surveillance usefulness in environmental compartments towards the protection of ecosystems. So I would like to open the floor to any questions that may exist among the participants. And also we have another question in the comments. So I will ask the question in the comments, and then anyone who wants to speak and ask their question orally, they can. So the question is, at NEMA in Uganda, are there any other sessions that monitor pathogens, and why are priorities given to chemical monitoring compared to pathogen surveillance in wastewater? This is the first question.
Oh, thank you, Poppy. Now, like I was trying to introduce, I said I come from an environmental perspective. We do not monitor pathogens, but we actually monitor chemical pollutants. You know, we do not do a lot of microbial research and maybe monitoring. We do a lot of chemical and physical parameters. Yeah, so we do not monitor waste. Ministry of Health does the monitoring of those pathogens. So they also do the studies, like for example, they will tell you they do early warning for SARS-CoV-2, maybe they do for other pathogens like Marburg and everything. Yeah.
Thank you so much. Do we have any other questions from the audience? Yeah, we have one question from Jesse. Please, go ahead. Can you hear us, Jesse? You have your hand raised.
Okay, thank you so much. I wanted to find out from Uganda how they've strengthened the component of health impact assessment in the EIA process. Yeah, okay. So because I know that for the Zambian case, the health impact assessment is not very strong. As a result,
okay. Again, to answer the question, I would say we issue environmental and social impact assessments and not health impact assessments. NEMA is mandated to take care of the environment and in so doing maybe protect the ecosystem and the people, but we do not issue health impact assessments. No, we do not. Though, like I said, amongst the conditions, we issue conditions that deal with public health and even protecting your workers. Then the Occupational and Health Safety Department of the Ministry of Gender, Labor and Social Development may come in to do with health impact assessments, but NEMA deals with environmental and social, not health. Thank you.
Thank you. So we have another question from Abdallah. Please go ahead.
Yeah, good afternoon.
Good afternoon, Abdallah.
Okay, all right. I want to find out because I'm also from EPA Ghana. So we do similar chemical analysis and other in wastewater, that's industrial effluent. Then we have other institutions that are also in charge of the pathogens and so on. But do you normally work together with them so that you can have a comprehensive component of whatever wastewater you analyze, so that you can have the pathogen bit of it together as one report? Do you do that?
Well, I would say, thank you, Abdallah, and greetings once again. So I would say we do have, where there's, because we have a cross-cutting mandate somewhere, somehow. So we do have times when we work with them, and the reports we share, okay, when we go to field and do analysis, pick samples and everything, each agency will monitor their primary objectives. For example, NEMA will monitor the environmental aspect, maybe Ministry of Health or Uganda Virus Research Institute will monitor the public health aspect, like that. But yes, we do have it.
Thank you. So one last question from the audience. We have Andrea Rachenburg. Please go ahead. And this is the last question that we will have, and you can post the rest of your comments and questions in the chat so that Michaelo can answer later on.
No.
So Andrea, no? Yeah.
I can't do anything. I don't know if anyone hears me.
Yes, we can hear you.
Perfect, but sorry, it was a mistake, and I can't react and take the hand down.
Oh, okay.
Sorry.
All right, thank you. So next we have another question from Baya, the last question.
Can you hear me?
Yes.
Yes, we do.
Hello, everyone. Thank you so much for the wonderful presentations. I have a question. So I understand that we have these amazing surveillance tools, but my question is, do you, either the World Health Organization or any other agency, have a framework to ensure that the generated data using these surveillance tools are used or utilized for public health decision making? That's my question to anybody. Thank you again.
Okay, I guess Poppy, that will be yours. But a part of it, like I was mentioning in my presentation, I said policy making comes, you cannot make a policy when you do not have the data. You have to monitor, inspect and monitor, and you collect enough data that will help you to do what? To develop these policies and maybe inform the public about how much or how you need to avoid some of the aspects that you've been working on. Okay, maybe the rest of the team can actually answer.
Yes, thank you. So indeed, tools to collect data are very important, and this is why we're building the capacity for people to be able to set up the tools, their own individual tools to collect the data, both from an environmental perspective and from a public health perspective, and see how everything can be analyzed and interpreted towards the benefit of the community. So yeah, I would thank you so much for all of your questions. This has been a very interesting session. I would like to pass the floor on to Taru now for the next part of the webinar. And thanks again, everyone, for your very kind contributions. Thank you.
Thank you very much, Poppy, and both of the presenters about your very interesting presentations and also very active discussion based on those. You can still keep sharing the questions in the chat if you have some questions still on mind. And meanwhile, we are now in the very end of this first webinar, and we would like to share you the post-webinar survey. I believe, Josephine, maybe you can place the link to the chat, and we will just take a couple of minutes to make sure that everyone can access the link, and just let me know if there are any issues so we can try to solve them. but it should be working both with the link, or then you can scan the QR code of the feedback survey. And if you're able to access, you can answer now or then also, of course, later on. But we wish you all to answer the survey. It will help us a lot with the upcoming webinars and also the online training program. I also believe that Josephine asked if everyone could, or everyone or those who want to be in the picture of the first webinar could open their cameras, so we could take a screenshot of this first webinar. And yes, just if you feel so, of course, no pressure, but and then maybe Josephine, if you can take the picture once you feel like we are ready. And then, of course, also at the same time to see if you can access the post-webinar survey. Please let me know if there is any issues with that. I see, Monica, you have a lot of people there in one camera. Great. Nice. Thank you all. I hope, Josephine, you were able to catch the picture. And so with this, I thank you all for joining today's session. Your active engagement and thoughtful questions reflect the growing interest and importance of this topic, as we have seen during the presentations also today. And we hope that today's presentation have sparked new ideas or encouraged collaboration between the sectors. And we look forward to welcoming you to the next webinar. So as we said, we will have altogether 8 webinars. So there will be a next one, I believe, in September. And we will, of course, communicate with you about that one. And yes, with that, I would like to thank you all and see you in the next webinar and to fill also the survey. Thank you.
Thank you, everyone. Bye-bye.
Thank you. Bye. Thank you.
Thank you.
Goodbye.
Bye. Thank you.